What's up guys, I'm Justin Stenstrom from Elite Man Magazine, and in this video I'm going to share with you how to take control of your health. Because whether you realize it or not, your health is the most important thing in your life. It is your number one priority. You can't go out and have fun, you can't work, you can't take care of other people unless you take care of yourself first and have good health. And I hate to break it to you, but the cavalry isn't coming. Nobody else is going to take over your life and be in charge of your health. That's up to you. So, with that said, let's dive right into it. The first thing that you have to do when it comes to taking control of your health is make sure you got the big three down. The big three is eating healthy, working out regularly, and getting 7 to 9 hours of quality sleep every single night. This is the foundation for good health. All the other stuff is supplementary. All the other stuff matters, but you have to have this stuff down first before you can actually be healthy. If you're lacking in one of these key areas, the chances are you're probably unhealthy. If you're lacking in a couple of these key areas, the chances are you're probably really unhealthy. So with that said, you really got to cut out all the crap that you're eating. Eat more fruits, veggies, good proteins, and cut back on all the fats. Also, you should be working out at least 4 times every week, preferably more like 5 to 6 times every week, but 4 times at a minimum. And as I mentioned before, sleep is so important. 7 to 9 hours of sleep every single night is essential for you being at your best. Unfortunately, most people don't have these things down. Their diet is complete dog shit. They eat all kinds of crap all day long and never eat their clean fruits and veggies like they should. They skip out on the gym all the time, maybe go once a week and then skip next week. And as far as sleep goes, they're probably sleeping like 4 to 5 hours a night. And then they wonder why they're always sick, and they wonder why they're always at the doctor's office, and they wonder why they catch the flu every single season, and they wonder why they walk around with 0 energy and 0 motivation. All of these things add up over time, and they break down the body constantly, stress your immune system, and tax all the organs in your body, and eventually they lead to things like chronic disease. And you've probably heard this before, but chronic disease is going up. It's getting worse. Every single year it rises, and you would think with how advanced we are with technology and living in probably the most advanced civilization in history, that number would be going down. But it's not, because so many people are overlooking these very 3 essential areas. But don't be one of those people. Take control of your health right now by making sure you get these fundamental things down. The second thing that you have to do to take control of your health is take what doctors say with a grain of salt. Now, I know this is going to be a controversial step, but it is so important and so true that you do this. I am not saying to not listen to what your doctor says. I'm not saying to disregard what your doctor says. I'm not suggesting that you don't go to your doctor. I would never do those types of things. What I'm saying is take what your doctor says with a grain of salt. Don't just take it all in as if it's gospel and if it's fact. And don't just take it all in as if this is the only authority on the matter that you have. There are also many other doctors that you can get 2nd, 3rd, 4th, 5th opinions from, and you don't have to just listen to what that one doctor says. Especially if you don't believe what they're saying, or you don't trust what they're saying, or what they're saying is actually detrimental to your health. There's something called the Nocebo Effect, which I'm sure you've heard of the placebo effect, which is the opposite of the nocebo effect. The placebo effect is basically when a doctor gives a sugar pill to a patient and tells them that they're giving them a treatment for whatever it is that they have. That patient, despite getting just sugar in a pill, which is literally nothing, will actually become healthy. They'll heal themselves just by thinking that they're getting the actual treatment. They're getting the solution to their problem, and the mind will actually take over and will heal them. Placebo effect works about 30 to 33% of the time, depending on who you ask or which studies you cite. But basically, your mind can heal itself about 1/3 of the time when it thinks it's actually getting a treatment. That's an incredible thing. Science really hasn't explained how that works yet. On the other hand, the nocebo effect is just as effective in actually making you sicker when a doctor tells you that you're going to be sick. So just like your mind can heal your body when it thinks it's getting something good, your mind can actually make things worse when it thinks it's getting something bad. For instance, oncologists, when they give people, say, 6 months to live when they have terminal cancer, people will usually die right on the dot or around that time of, say, 6 months, because their mind is already programmed that they're going to die around that time. And when people are not given that death sentence of, say, 6 months, or they're not told that they're going to definitely die within a short period of time, they actually live longer. Or even better than that, when they get the opposite and say that there's a way, there's a possibility, there's a chance that they can heal if they do these things, they can actually beat the cancer, they do much better than the people who are given the death sentence and and told they're gonna die soon. So this, on top of the fact that doctors really aren't invested in your health as much as they should be, or as much as you are. They have so many other patients that they see throughout the year, and they probably only see you a couple of times or a handful of times at most, and probably for like 10 to 15 minutes, and then they're rushing you out the door. Now, it's really not even their fault, because if you think about it, that's just how the system is. It's built to get as many people through the door as possible and then send them on their way as quickly as possible so they can get more people coming through. But realistically, that's no good for you, because this doctor is not spending the necessary amount of time to really get to know you and get to know your health. I'm sorry, but 10, 20, 30 minutes out of a whole year to really try to figure out and understand your health just isn't going to cut it. So if you think that your doctor has your best interest in mind, you got to think again. The third thing that you have to do to take control of your health is to do your own research. Building off the last point of actually realizing that the doctor isn't spending as much time as you really need them to spend on you to figure things out. And again, it's not even really their fault, but it's just the reality of the situation. Realizing this fact, you got to go out, you got to do the research, you got to find the information that you need to take care of yourself. Your doctor probably sees hundreds of different patients every single year, and if you think that he's focusing all his attention on you and the exact symptoms of what you have in your health, you're mistaken. There's just so many other things to do than for him to go home and do his own research and think about things and invest the time that it takes to learn different things for you to get better. No, unfortunately, that job is up to you. You got to take charge. You got to do the research. You got to find the information. You got to find all the resources that you need for your particular situation. If those hundreds of other patients were wise too, they would do the same thing, and they would come armed and equipped with the information needed, and then they can present that with the doctor, and together you guys can formulate a better plan. But if you think that the doctor's going to do this all by himself, it's just not going to happen. Also, mainstream health application. When you go to your doctors, the things that they tell you, the things that they prescribe you, the recipe for you to get healthier, all of this stuff is generally 20 to 30 years behind new cutting edge research. That means that there's breakthroughs all the time in science, and this doesn't actually get applied to what's happening in real time until 20 or 30 years down the road. There could be multiple studies out there that tell you exactly what you need to do, exactly what you got to take, exactly the process for getting healthier, new stuff that's actually cutting edge and working in the lab and on rats and on humans. All of the stuff that they're testing in real time, this stuff can actually be applied to your life too, but the thing is, you're never going to hear about it from your doctor. Your doctor probably doesn't even know, so you would never hear about it from them. But if you do the research, you can actually get this information and apply it to your life right now. You can bring it to your doctor, and together you guys can formulate a plan together, or you can find some other doctors who actually know about this research and are doing these types of things. But the point is, you have to take action. If you really want to be at your best, if you want to heal a condition, if you want to feel 100%, it's up to you to figure out what you have to do to get those things done. And the fourth thing that you have to do to take control of your health is to take responsibility right now for your health. Now, I've basically alluded to this fact the entire video, but I want to make it very clear right now. This is probably the most important thing out of all. You really must own the fact that you're in charge of your health. Nothing else is going to come. No one's going to come save you. The cavalry ain't coming. Your doctor ain't going to save you. Your wife ain't going to save you. Your friend ain't going to save you. You must save yourself. Sure, all of these people, and your doctor included, can definitely support you and help you along the way, but at the end of the day, you make the final decision. You're in charge of your health. Own this fact. Take charge of it. Do the things that you know you have to do every single day, every single week to be at your very best, and take control of your health. Don't let anybody else do it. It's up to you. Take responsibility, and take responsibility now. That's it for today, guys. If you enjoyed this video, leave a like below, and also share in the comment section what you do to take control of your health. Also, make sure you check out some of our other fantastic videos on the channel to help you become more of an elite man.